I'm Dr. Mohammed Waqas. I work with CHIS and Vincent Heart Institute. I'm specialized in advanced congestive heart failure and pulmonary hypertension. For the longest time, pulmonary hypertension was actually called an orphan disease because it was not thought of as much. Hence, patients who had those symptoms, they were not considered to have pulmonary hypertension for a very long time. To this date, the average time of diagnosis from symptom onset of pulmonary hypertension is about 2.5 to 3 years. So by the time patients come to us, they have been short of breath or have those symptoms of pulmonary hypertension for at least 2.5 to 3 years. It's still unfortunate, and in 1985 actually, one of the biggest studies with the NIH showed that the symptom onset to diagnostic time was about 2.5 to 3 years. And into 2018 or 19, we still are struggling with the same problem. Patients who get symptoms of PH early on, by the time they reach a pulmonary hypertension specialist or get diagnosed, it still takes 2.5 to 3 years. Things are slightly getting better because there is more awareness among patients, there's more awareness among physicians and healthcare professionals to think about this disease and start working up this disease early on. You wonder why it takes so long, because pulmonary hypertension has almost exactly same symptoms that every other condition can have. The most common symptom of pulmonary hypertension is shortness of breath. As we know, any other disease state can cause shortness of breath, be it lung condition, heart condition, low blood count, patients who have bad joint diseases. All those disease states can lead to shortness of breath. But there are some distinct features of pulmonary hypertension that separate that from other disease conditions. But as any young or old patient that goes to physician complaining of shortness of breath, we look for simple disorders first, rightfully so. But now we are trying, with awareness, we're trying to improve that awareness among patient and healthcare professionals to think about this disease early on if there are certain risk factors present in patient history profile.